بسم الله الرحمن الرحيم. Regmatogenous retinal detachment. هنتكلم عن examination, diagnosis and different diagnosis. As we see, this is the normal appearance of the fundus. When you examine the fundus, you have to comment on the optic disc, including the optic disc cup. You can comment on the retinal blood vessels, arteries, veins, of course, macula and the fovea. And this is the histological features of the retina. You have to know that the retina is formed of 10 layers. The most important is the retinal pigment epithelium with the 9 sensory retina. Regmatogenous retinal detachment occurs due to separations between the retinal pigment epithelium and the sensory retina. So it occurs between the 9 layers and the retinal pigment epithelium. And this is the space in which the fluid collects under the sensory retina, causing the regmatogenous or the retinal detachment. Methods of fundus examination include the direct ophthalmoscope, indirect ophthalmoscope, and indirect slit lamp by microscope. This is the direct ophthalmoscope, and this is the indirect ophthalmoscope. And of course, we have mini slit lamp by microscopy used with the slit lamp. The most important is the 90 diopter lens, 78 diopter lens, and of course the Goldman 3 mirror contact lens. Symptoms and signs of regmatogenous retinal detachment. You have to have patient may have floaters, flashes, field effect, and falling of vision or diminution of vision. The signs includes retinal tears or breaks, subretinal fluid, and loss of the choroidal pattern. The retinal breaks can be, you have to know the definition of the retinal breaks. It is breaks between occurs in the retina, and it be classified. A retinal break is, again, the definition, it is a full thickness defect in the sensory retina. It can be classified according to the pathogenesis, the morphology, and the location. And according to the pathogenesis, it may be tears which are caused by dynamic vitreoretinal tractions and have a predilection for the superior fundus, or holes which are caused by chronic atrophy of the sensory retina and may be round or oval. They have a predilection of the temporal fundus. And according to the morphology, it may be a U-shaped tear or horseshoe tear. It may be incomplete U-tears or operculated tears. It may be a retinal dialysis or a giant retinal breaks which involves 90-degree or more of the circumference of the glue. And you can see here the types of the breaks. And according to the location, it may be oral breaks, post-oral breaks, equatorial breaks, or post-equatorial breaks, or macular breaks. How to find a primary break? A primary break is one responsible for the retinal detachment. A secondary break is not responsible for the retinal detachment because it was either present before the development of the retinal detachment or formed after the retina is detached. Finding the primary break is of the paramount importance and aided by the following consideration. It depends on the distribution of the breaks. It's mostly in the upper temporal, followed by the upper nasal, followed by the lower temporal and lower nasal. Also, the configuration of the subretinal fluid. You can judge on the retinal detachment from the configurations, and you can know where the break. And here is some of the examples that you can find the break. You can just read it and think about it. Changes secondary to retinal detachment may be macular edema, macular hole, thinning of the retina, intraretinal cyst, demarcation lines, BVR, and subretinal fibrosis. The signs of long-standing retinal detachment include retinal thinning, secondary intraretinal cyst, subretinal demarcation lines, retinal vessels that develop telangiectatic-like tuft-like projections, immobility of the retina, pre-retinal membrane formation. BVR is a clinical syndrome associated with the retinal traction and detachment in which cells with proliferative potential multiply and contract on the retinal surface and in the vitreous compartment. There are risk factors for BVR, which is trauma of the eye, vitreous hemorrhage, previous eye surgery, RD with more than 2 quadrants, RD associated with choroidal detachment, inflammations, RD associated with Wagner's and Marfan syndrome therapy. And here is the classification. It may be classified into A, B, or C. C may be anterior or posterior, and according to the type, it may be focal, diffuse, subretinal, circumferential, or anterior displacement. Here are the pictures of the BVR, and these are the colored codes. How can you draw the retinal detachment or the retinal detachment chart? The differential diagnosis of retinal detachment, it can be differentiated from other types of retinal detachment like tractional retinal detachment, combined traction and rhegmatogenous retinal detachment, and exudative one. Also choroidal detachment, peripheral degenerative retinoschisis, uveal effusion syndrome, peripheral cystoid degeneration, extensive retinal edema, macular cyst with a hole, and this is it. Thank you very much.